Before, I would get very tired in the afternoons. I would even sometimes go home and nap in the afternoons just because I was worn out and tired and my body would hurt or ache, or if I was busy with work, my knees would hurt throughout the day.
The patients before surgery typically are not active, not because they don't want to be, but because it's too physically demanding. Often suffer from depression, often are on many medications for their weight-related health problems.
Before the surgery, I had several major health issues, one and probably the most severe being high blood pressure. I have a congenital heart disease as well, and my blood pressure being as high as it was definitely causing concern and issues with my heart.
Gastric sleeve is an operation that we do for weight loss. Obviously, it's an operation where we reduce the volume of the stomach by between 75 and 85%. We remove the greater curvature in the body of the stomach and leave a tubular structure which is approximately 3 to 4 ounces in volume.
Another advantage of the gastric sleeve is that the complication rate is low. Again, it's done laparoscopically, which is through small incisions. The risk of wound infection is lower when we do things laparoscopically. The risk of the pain is less. The recovery time is faster.
Pre-surgery, I weighed 325 pounds when I decided to have the surgery. The morning of surgery, I weighed 317.9 pounds, and currently I weigh about 174 pounds.
With the sleeve gastrectomy, you can expect between 55 and 60% excess body weight loss, with a resolution of your comorbidities on the level of about 80 to 85% of the time.
People talk about an increased energy level, increased sense of well-being. They often can do activities that they haven't been able to do before.
Yeah, my life now is very active, very enjoyable. I don't hide or shy away from any activity. I ride my bike on a weekly basis, if not a daily basis. I work out 5 days a week at the gym. I traveled 2 weeks ago, and for the first time in my life, I didn't have to have the armrest up the entire time to fit in the seat. That was a great feeling. I would say I'm as close to being perfectly healthy as possible. I still have a congenital heart defect that I'll have to have worked on in the future. But overall, I feel great. I'm stronger than I've ever been before. I have more energy than I've ever had before, and life just couldn't be better.